We're really excited that at Magee-Womens Hospital of UPMC, we're putting together an entirely new way of taking care of older people. It's designed to prevent problems from happening before they occur, and it's designed to change the whole system of care for a hospital. And we're really excited because it will allow us to provide much better care to older people than we've been able to do in the past. When younger people come into the hospital, they have an acute condition, and that's it. So all of our attention focuses on that. They'll get better. By contrast, when an older person comes in with an acute problem, it's layered on top of their pre-existing problems and conditions, sometimes 4, 5, or 6, and even 10 medications. And so the acute problem then can tip over those other problems so they become worse and then result in complications. So the beauty of the program is it allows us to focus on the whole patient and all of the problems before we design an individual plan of care. The success of the program hinges critically on training every person who comes in contact with an older person, because a problem can occur at any point in the hospitalization, from the time they enter the hospital to the emergency room to the ward and all along the way. That means that we train every discipline throughout the hospital how to recognize problems in older people, how to develop a plan of care to prevent a problem from occurring, and how to recognize a problem if it still does occur at an early stage when it's treatable, and then we empower them to intervene actively to prevent it from getting worse or to correct it if it's already occurred. Part of providing an optimal environment for older people is to ensure that some orders are standardized in ways that take into account the problems that older people have. We've created specific sets of orders, therefore, that are tuned to the needs of older adults, and that focus, for instance, on improving the way they're fed, the way they get out of bed, the medications that they get, their pain management, and other problems that are common for older people. Some of the things that are special about the program at Magee and Geriatrics is that we take care of men and women, and we focus on medication management to make sure that we get the medicines right, and we take a preventive approach because so much of what happens in the hospital can be prevented if you thought about it in advance and took steps to make sure they didn't occur. We're in Allegheny County, which is one of the oldest counties in the country in terms of the age of the people who live here. We have one of the strongest divisions of geriatric medicine in America, with geriatricians who are sought out for their expertise and care by physicians around the country. And we're embedded in a healthcare system at UPMC which has the resources and the commitment and the vision to support the kind of innovation which is critical to develop this new approach to geriatric care.